Hi everybody, this is Elka. Welcome to my PowerPoint video on yoga and diabetes. How yoga affects blood sugars and other risk factors associated with type 2 diabetes. So a little bit of background about why I wanted to research this topic. I've been a nurse for 10 years and I've noticed a dramatic increase in the number of patients that I treat for diabetes. And I've also been practicing yoga for about 20 years, and I've been a registered yoga teacher for the past 2 years. So what is diabetes? There's actually two different types. Type 1 diabetes is an autoimmune disease where the person's immune system attacks the pancreas, preventing it from making insulin. This form is more common in children and young adults, and it doesn't really have anything to do with lifestyle choices. In type 2 diabetes, the body either doesn't make enough insulin or it isn't able to properly use the insulin that it does make. This type is more common in adults, but it can actually appear in anyone, and it is related to lifestyle choices. Therefore, this research was focused on type 2 diabetes. So a little background about yoga. Practice of yoga can be traced back approximately 5,000 years to the very beginnings of civilization on the Indian subcontinent. The Pashupati seal dates from this time period and is thought to be the earliest depiction of an asana or a yoga posture. The word yoga first appears in the Rig Veda, written between 3,000 and 3,500 years ago. And here's a very brief history of diabetes. The symptoms of diabetes were first documented in a medical papyrus by the ancient Egyptians about 3,000 years ago. In ancient India, this disease was called madhumeha, which means honey urine, because ants would be attracted when a patient urinated because of all the sugar in their urine. The ancient Greek doctor Apollonius of Memphis, pictured here, is believed to have coined the word diabetes in the 3rd century BC. And the famous Roman doctor Galen was aware of the disease, even though he did admit that he had only ever seen a couple of patients with it, which suggests that it wasn't as common back then. By the 5th century, Indians and Chinese had noticed that it was more common in overweight wealthy people. And in 1776, Matthew Dobson found that it could be fatal in some people, but chronic in others. What does diabetes look like now? The most recent data that I could find was from the CDC in 2017, and they estimated that 30 million Americans had diabetes. What I found most disturbing, though, was that the population with the fastest increasing rates were children. And diabetes is now the 7th leading cause of death in the United States. So what's the connection? The symptoms and risk factors for type 2 diabetes can be reduced through healthy diet and aerobic exercise. We all know that. Even ancient doctors prescribed a healthy diet as a treatment for patients exhibiting symptoms. But I wondered if yoga would be an appropriate intervention, mainly because yoga isn't necessarily aerobic. So would it do enough to help the body use insulin? Fasting blood sugar is important for diabetics because it measures how well your body is managing sugar or glucose without any food involved. So it's kind of like a baseline. And fasting blood sugar was significantly decreased by practicing yoga. The most dramatic statistics I found were up to a 60-point drop in the fasting blood glucose. Postprandial blood glucose measures the amount of glucose in your blood approximately 2 hours after eating. So it kind of looks at how well your body is managing sugar after a meal. And again, the postprandial blood sugar was significantly reduced for diabetic patients with a yoga practice. Hemoglobin A1C is the third traditional blood test for diabetics. It's more of a long-term test. It kind of looks back at the past 3 months for how someone with diabetes has been doing, how well they've been managing their diabetes and their blood sugars. And hemoglobin A1C was improved by a yoga practice, though not as significantly as the fasting blood sugars and postprandial blood sugars. High blood pressure and type 2 diabetes are intimately linked, probably because they have similar risk factors such as obesity, unhealthy diet, and inactivity. Practicing yoga decreased both systolic and diastolic blood pressures, and the numbers weren't huge, but these are pretty significant, especially if somebody is already suffering from high blood pressure, because this reduces the risk of heart attacks and stroke. Type 2 diabetes and cholesterol are also very closely linked, and I found it amazing that a consistent yoga practice improved all types of cholesterol. Total cholesterol was decreased, triglycerides were decreased, LDL, which is the bad cholesterol, was decreased, and HDL, which is the good cholesterol, was increased. And again, this is a pretty big deal because these improvements help reduce the risk of high blood pressure and coronary artery disease, something that diabetics are already prone to. Yoga also produced pretty significant reduction in body measurements. BMI, waist circumference, and waist to hip ratio all saw positive changes, and all of these are risk factors in type 2 diabetes. One other thing I found was that yoga had a very positive impact on certain markers that measure oxidative stress in the body. And I wanted to look at this because stress has a very negative effect on people with type 2 diabetes. And it found that all of the markers were improved, and the yoga practice reduced oxidative stress in diabetic patients by 20%. And in conclusion, it works. Yoga does seem to be enough physical activity, even though it's not necessarily aerobic, that it could be considered an appropriate intervention for type 2 diabetes when it's incorporated into a healthy lifestyle, healthy diet, still using any prescribed medications. Thank you very much.